Hi, my name is Brittany Williams, and today I'm going to be performing a head to toe assessment on a post surgical patient. So, first, I'm going to knock on the door, close the curtain to ensure patient privacy. I'm going to perform hand hygiene and put on my gloves and introduce myself. Hi, I'm Brittany. I'm going to be your nurse today. Can I please get your name and date of birth?
2658 Darlene Williams.
Okay, can I take a look at your wristband? All right, everything looks good. So I know you just recently had a surgery. What type of surgery was that?
I had my tonsils removed.
Okay, are you having any pain?
None.
From a 0 to 10 of pain, where would you rate your pain if you have any?
0.
All right, so next I'm just going to make sure the patient is aware and alert. Could you please tell me what month we're in?
We're in August.
What city are you in?
I'm in Sacramento.
And who's our president?
Trump.
Okay. All right, so next I'm just going to look at the patient's skin, check for any bruising or scratches, lesions, markings. It's dry, it looks normal to her skin color. Gonna just observe her head. Don't see any swelling or lumps. Okay, so next I'm going to begin her assessment, starting with her head, as I was doing. It's symmetrical. All her features are symmetrical. I'm just going to palpate around her sinus and nose. Okay, there's no lumping or swelling. I'm going to look inside of her nose. If you can look up for me. Higher. Okay, there's no redness or bleeding. Nares are patent bilaterally. I'm going to check your lip, nose, and your neck area, trachea. You can swallow. Okay, swallow feels even and normal. There's no swelling or lumps in her neck area. I'm going to have you say ah. Can you hold your head back? All right. Oral mucus looks moist and pink. There's no signs of bleeding. Tonsils are removed, but I don't see any bleeding or swelling or infection going on. Teeth are intact. Lips are moist and pink. Tongue moves up and down symmetrically. Okay, everything looks good. Now I'm going to check your ears. Okay, I don't feel any swelling or breakage behind her ears. Alright, there's no drainage or swelling or anything going on inside of there. Next, I'm going to check the range of motion of her neck. You can look from side to side, up and down. Alright, range of motion is good. I'm going to press down on your shoulders and you can move the shoulders up and down. Alright, good movement. Next, I'm going to check her eyes. You can just look forward. Look forward, you don't have to look at the light. Alright, both pupils are reactive, equal in size. Okay, the sclera is the normal color. There's no dryness. Her conjunctive is pink. Everything looks fine. Next, I'm going to move down to her breathing sounds by checking her lungs. Have you had any trouble with coughing or breathing lately?
No.
All right. So I'm just going to have you take deep breaths. Okay, breath sound good in all lobes. Next, I'm going to check her cap refill on her fingers and toes. Alright, cap refill is less than 3 seconds in her fingers and less than 3 seconds in her toes. Next, I'm going to check her pulses. Temporal, radial, the groin. If she was undressed, we're going to act like she was. Okay, all pulse sites are +3 bilaterally. Next, I'm going to listen to her heart. Alright, heart sounds are present, no murmurs or anything going on. Next, I'm going to check her range of motion and her strength, the coordination of her arms and legs. So if you could just hold your arms out and go up and down. You can touch your nose and touch my glove, my finger. Other. Okay, range of motion and coordination is good. Next, I want to check her legs. And bring your leg out. And then when I push back, you push forward. Okay. Okay. Range of motion and lower extremities are strong and normal. And you're just going to have you push back on my hands as I push forward. Okay, strength is good in her upper extremities. Next, I'm just going to have you, we're going to check your gait. Have you just stand up, take a few steps forward, and then walk back.
Sit.
Yeah. Okay, her gait is steady. So next I'll perform her vitals. We have her blood pressure at 122/82. Respirations are at 18. Pulse is at 86. Saturation is at 98% on room air. And temperature is 37.6 Celsius. Alright, next I'm going to listen to her abdomen. Have you had any trouble with bowel movements? And what was your last bowel movement? Okay. Okay, bowel sounds are present in all 4 quadrants. Next, I'm going to palpate to assess for any lumps or masses or tenderness. Alright, so next we're going to do the whisper test. I'm going to say a word, say a number in your ear, and then you're going to repeat it.
22. 44.
Okay, next we're going to check her senses and sensation to touch. You can close your eyes and smell this. What does it smell like?
Alcohol.
Okay. Next we're going to test for sensation. You're going to feel something sharp and dull. You let me know what you feel. What does that feel like?
Dull.
What does that feel like?
Sharp.
Okay. So if I was to do the Gaslow Coma scale, she would be at a 15. Next, we're going to perform the Snellen chart test to test her eyes. I'm just going to have you get up and face me. Face me. And back up a little more, right? Come up a little more. Okay, so we're going to pretend we're 20 feet away. I'm going to have you cover your left eye and read the first line for me.
E,
Second line.
E, F, P,
Third line.
Z, O, T, O, Z,
Fourth line.
L, P, E, D,
Fifth line.
P, E, C, F, D.
Okay, go ahead and switch eyes. First line.
E,
Second line.
F, P,
Third line.
T, O, Z,
Fourth line.
L, P, E, D,
Fifth line.
P, E, C, F, D.
Okay, that'll be it. You can have a seat. So if I was to rate this, she'll have a 20/50 result in both eyes. Okay, so that concludes this assessment. If you have any questions or anything, just let me know so I will perform hand hygiene and document.